Hi, my name is Sara Guevara. I'm a board-certified family medicine physician. I'm faculty at the Glen Cove Family Medicine Residency Program, part of Northwell Health. Prior to medical school, I completed my research fellowship at the NIH, and after residency, I completed a clinical leadership fellowship at New York City Health and Hospitals. I was born and raised in Brooklyn. I grew up in a loving immigrant family. Both my parents immigrated from Honduras, and we spoke Spanish at home, and education and service to others were always emphasized. One of the things that inspired me to become a doctor was my experience being a medical interpreter during college. It granted me the opportunity to witness the value of empathy, effective communication, and cultural humility within the physician-provider relationship. I think having that opportunity to witness these interactions inspired me to pursue medicine and integrate my passion for science and service. After training, I had the opportunity to build rapport with my own patients and embrace those connections and partnerships with my patients as I empower them and provide best quality care. Throughout my training, I focused on the social determinants of health and how to best address them, both at the individual and system level. And I would say that through my personal and professional experience, I have become more and more inspired to address these health disparities and improve healthcare delivery using various research methods to evaluate and identify community needs and find solutions. After residency, I had the opportunity to join the NYC Health and Hospitals Central Office team as part of my clinical leadership fellowship. There, I had the unique opportunity to be a part of the NYC Care leadership team. NYC Care is a healthcare access program in the city that provides healthcare services to all patients regardless of ability to pay or immigration status. There, I had the unique opportunity to learn from the community-based outreach model that helped throughout community-based organizations connecting to community members. We were able to address any questions or concerns. As part of NYC Care, I also had the ability to look at the data and how health and chronic conditions improved as patients joined the healthcare access program. For example, patients that had diabetes that was never controlled because they didn't have access to medications, once they joined the program, we were able to start tracking their level of hemoglobin A1C. And there were many cases where the A1C improved, and we believe that providing primary care access will prevent any unnecessary emergency department visits and just bring and improve health for all. It was truly a great privilege to witness and advance population health by improving healthcare delivery in the nation's largest public healthcare system. And it inspired me to continue pursuing healthcare leadership opportunities so I can continue to advocate and help underserved communities. I think my experience with clinical and community-based research and community health has greatly impacted my practice of medicine, and it has granted me the opportunity to analyze health equity through a different lens. I feel called to action to address the need for community-partnered interventions, primary care practice improvement, and policy change. My opportunity doing research at the NIH, I was able to combine my interest in research, clinical trials, and health disparities, as I was part of a ketamine study to treat depression, and where since I spoke Spanish, was able to help enrollment of more Spanish-speaking participants in the studies as well, to increase the diversity of the participants of research trials, to then help a larger community and population once we find better treatments. Another community-based research opportunity when I had the opportunity to interview patients and ask reasoning and different barriers that they faced when to access immunization for the flu, for example. was very helpful. And I think my mentors have made a huge impact in giving me the opportunity to pursue these passions where I can integrate my passion for service and my passion for research to find solutions and study the problems so that we can address them. And I'm looking forward to what the future brings.